I was taught to directing it at the lunate, okay, but the article we just read looked at the scaphoid. I've done both before for patients. I think the biggest difference, actually one wasn't a patient, one was the occupational therapist that works in my clinic. She was having a lot of medial wrist pain and discomfort. And so one of the things you do is in assessing it, and I would have my hand on the lunate, and I was going through the range of motion. The end range of the motion, it's like a whipping action, so the end range is a quick whipping movement. So I would get the person into that end range. I was taking on that, is that painful? No, not really. Didn't seem to be too limited or anything. And then I move over to the scaphoid, which is the most medial of the carpal bones. And I was going there, and she's like, oh yeah, I can feel that. And sometimes you'll almost feel like the carpal bone clunk in there, and someone that really needs it, you kind of go through it, and you kind of just feel that clunking motion. You can kind of really tell. The movement is the same. It's more of a general down, also a down and out, especially at the lunate. So if I decide to do the lunate, anything there that's a distraction? Okay. Finding the lunate. I go to the lunate more in individuals who have carpal tunnel syndrome. A lot of times what happens to the lunate is it gets shifted downward some, and it kind of encroaches that carpal